I'm Brian Gallagher. We have a guest in studio today from Central District Health Department. Trace Anderson's here to bring us up to date on things that are going on down in the big building. Hello.
Good morning, Brian.
Welcome back.
Thank you.
You've got some re-enrollment work that needs to go on because of all of the changes that have been going on post-pandemic. I'll let you explain what has happened and what is happening and what needs to happen.
Thank you. Since the emergency declaration for the pandemic ended, what we know now is that all the folks who have been on Medicaid for the last 3 years are going through a process called redetermination, which means they have to sign up again. And in 3 years' time, and certainly during the pandemic, people's contact information has changed. So while DHHS at the state level and Medicaid is trying to contact these people, some of them have probably relocated, changed their phone numbers, changed their postal addresses, and they're not going to know because they won't be notified that they no longer have Medicaid. What we're trying to do is be a stopgap there to make sure that if they are questioning whether or not, we want them to call us. We have folks on staff now, we call them community health workers or outreach workers, who can help verify if the person needs to reapply for Medicaid, and then we actually can assist with that application. If they're not eligible for Medicaid, then we can also help them in the marketplace to find a substitute insurance policy.
Over the last 3 years, or even a little longer, depending on your perspective of the pandemic, we all found out that we have limitations. We also found out that sometimes the things that are out there, for lack of a better term, the cooties, but they go beyond the limitations. We found things that affected us that we had no idea, and we didn't think there was any way it was going to last this long. And we're still not completely out of the woods anyway. So it's a good idea to make sure that you are set up properly for the future, whatever the future holds.
Right, and what we want is for people to know that those resources are there. So if you're Medicaid eligible, we want you to be enrolled, and that will help you to get the health care that you need to keep you healthier, as opposed to not being able to go to a doctor's office because you can't afford it. What we find is that people who don't have insurance and don't have Medicaid often end up in the emergency room because there's no other source for them for treatment, and sometimes it results in overuse of the emergency room or inappropriate use. And so what we're trying to do is work through our system, and we're lucky to have our folks on board now who can help people get connected and make sure that they have what they need, so when they need to go for a well visit or a sick visit, they have their insurance card in their hand.
How long does it take to go through this process?
You know, it can be a little bit overwhelming, and there can be some barriers that are set up there. Generally, you complete the paperwork, and we can help with that. And then oftentimes you have to submit documentation as far as income and maybe some other papers. I'm not sure exactly, but we can help you, or I can't help you. My staff can help get the right documents to the right people, and then it should be a fairly quick turnaround. But if we don't do it all right the first time, it can be a drawn-out process.
And if you ignore it, it doesn't make it go away. You know, you need to make sure that this stuff is set up for your success.
You do, because when you call for a doctor's appointment, they're going to ask you for your insurance information. And if you don't have insurance, they may not be able to see you. So what we want to do is make sure that everybody has a stable medical home, and part of that is making sure that they have coverage for health care.
It's a good time to make sure that this is taken care of. They are doing Medicaid re-enrollment, and Central District Health Department is providing a hand. Is there information on the website?
There is some information on the website, but we would encourage people to call us to make an appointment, 308-385-5175. But go to our website as well and see what's there at cdhd.ne.gov.
There you go. Trace Anderson from Central District Health Department. Always a pleasure.
Thank you, Brian.
Good morning from AM 1430 KRGI 105.5 FM.